basically, so that you know, we're doing the presentations, we're doing the Q&As. We also are developing the Q&As from today, and others that we have will be included in FAQs that will be loaded on our website. We'll let you know when those are up and available, along with some other resources as well. I think that's it for our housekeeping type of thing, and so what we want to do is turn this over first to Steve Rosenberg to talk about what's new, and then to Jenny. So Steve, welcome.
Thanks, Sharon, and thank you, Courtney. I want to just contextualize this webinar and the ones that are following for a moment. So we've had 4 of these convenings so far, and quite frankly, they have exceeded all of our expectations. I think they've exceeded our expectations because those of you who have come have done a great job on bringing leadership to the table and beginning to work in a collaborative fashion, and that's been great to see. I think the goal that I've set out for these webinars is, as you guys come up with specific strategies in your counties, there is a fair amount of importance in being able to have a forum in which you can answer technical questions that may arise. So our overall purpose of this series is to basically create an ask process where this is an environment where no question is too silly or too repetitive, to make sure that folks get it and they understand the rule set that they'll be operating under. That said, on Monday, Jenny and I took a trip to Santa Rita, the Alameda County Jail, to look at opportunities for enrollment there. And I think what became pretty clear were several things. One was the potential use of MA, the Medicaid Administrative Activities, to fund enrollment activities at a county level. 2, the level of cooperation that we saw in Alameda County about folks wanting to pull together to make sure that every offender who entered that jail, whether they were there for an alleged misdemeanor or an alleged felony, would be enrolled in Medicaid or the exchange as they saw fit, and building systems and processes to do that. So I think that part was really exciting. I think the other thing that's exciting was the legislature's passage of 720. And Jenny, I think you're going to tell us more about what that is and what it says and what it means.
That's right, Steve. Thank you. And I wanted to add also my, I guess, feeling, that's in accordance with the way I know Sharon and Kathy and Steve feel, that the convenings have really been a very positive and exciting time to hear what's going on in counties. And I'm hopeful that as these webinars move forward, we can actually use them as an opportunity to highlight some of the best practices that are emerging based on your work. And I also wanted to mention that if you have technical questions that you don't want to wait for a webinar, because they're really critical for your work at the moment. There's another mechanism through which you can ask a question, which is at safeandjust.org. We have a help desk. You can submit a question, and Steve and I and the team will take a look at it and get back to you in writing quickly. And we may, depending on the question, check with you and see if we can share, that information with a larger group in a webinar setting. But if you need rapid response, you can always contact us by email or through the help desk. But I wanted to talk, as Steve mentioned, a little bit about AB 720, which we mentioned in most of the convenings, and has now gone through an amendment process and is actually on the governor's desk awaiting signature. So this bill, which was authored by Assemblywoman Nancy Skinner, has been amended to really provide, I think, some tools that will be very helpful for counties who are attempting to implement a jail-based incarceration, a jail-based enrollment strategy. So the 3 primary provisions of the bill as amended are: 1, 720 provides that counties shall suspend rather than terminate the medical benefits of individuals during the time they're incarcerated. So as many of you know, that type of policy has been in place for juveniles for a number of years, and this bill is going to extend that opportunity to the adult population. Second, it gives counties the statutory authority to apply for Medi-Cal benefits on behalf of an inmate who will be admitted to a hospital as an inpatient. So this parallels the authority that the state granted CDCR through legislation a couple of years ago. It extends that authority to the counties. Now, this the statutory authority that 720 is granting now as amended is a little bit narrower than what some of you may have seen in the original bill. But I still think it will be helpful for counties who are really working on a strategy to reduce the cost of inpatient hospitalization. And it's something that we can build on from here. There are other ways, you know, if jails are interested in exploring strategies to act on behalf of inmates to apply for Medi-Cal, there's other ways to accomplish that outside of statute, and so we'd be happy to work with you on that. And then lastly, and I think importantly, 720 clarifies that being incarcerated is not a reason for a county social service agency not to process an application for Medi-Cal, because, you know, as we know, being an inmate doesn't keep you from being eligible to enroll in the program. So that's where AB 720 is right now. Some of you, may be familiar with an earlier version of the bill that had a mandate for counties to enroll a certain segment of their jail population, or for county board supervisors to designate an entity who would do that enrollment. The amendment process ended up actually removing that provision from the bill. This bill is now, I think, really more about arming counties with tools to do enrollment, where there's already significant energy towards getting that type of program off the ground. It's really about breaking down some of the barriers. So we're really excited and cautiously optimistic to see the governor sign the bill, and we'll certainly update you when that happens and as implementation moves forward.
So Jenny, if I could be my nerd self for a few moments. In effect, what 720 does is it makes it clear that enrollment will be maintained at all times. That doesn't mean that coverage is maintained, but rather that enrollment is maintained.
Oh, yeah, of course.
Right. And then the second provision about inpatient hospital allows for the coverage switch to be turned on at the point at which an individual is hospitalized in a community hospital for greater than 24 hours. So what it does in my language would be it maintains enrollment, and it has a vehicle to turn on the coverage switch when that individual is eligible for coverage, i.e. when they're in a community hospital for greater than 24 hours.
Oh, certainly. But I think even for somebody who enters jail and is not enrolled, the statutory authority in the second provision, for inpatient hospitalization is going to be important even for people whose Medi-Cal is not in suspended status.
Right, that's correct. Great. And I guess, Sharon, at that point, we're opening it up for questions. Is that correct? And you're going to read the questions? Is that how we're doing this?
Yes, we are. And so the first question we have is, what if an individual does not enroll in an exchange plan during the enrollment period? Is incarceration or release from prison/jail considered a change of circumstances for purposes of enrollment?
And the answer is yes. So if an individual has not selected an exchange policy under Covered California by March 31st because they were incarcerated during the open enrollment period, then the point at which they are released subsequent to March 31st is considered to be a change in circumstance, and they are then allowed to enroll outside of the open enrollment period.
Right. For everybody out there, please remember to use the question box that's provided and send your questions to us. And if you're having difficulty with that, let Courtney know and she can help. So another question we have is, will public agencies be able to find out if an individual is already enrolled in Medi-Cal or Covered California?
So in terms of Medi-Cal right now, there is a vehicle through which agencies can seek out whether or not an individual is in fact enrolled in Medi-Cal. That's in wide use through the state. I don't think we know yet what kind of information Covered California will make available and to whom they will make it available. So I think that will have to wait a little bit longer until we get further along in the Covered California process.
Okay, great. And another question we have is, if the county determines that certain length or frequency of treatment is most effective for reducing recidivism, but Medi-Cal only covers a shorter length or less frequent treatment program, can the county supplement using other funding sources? And if so, how?
I need to decode that in nerd language, Sharon. So I think what the question is if a certain length of treatment meets medical necessity, and beyond that, the duration of treatment is no longer deemed medically necessary, can a jurisdiction pay on its own for services that are not medically necessary? I'm assuming that's the question that I'm being asked, and the answer is jurisdictions do that currently. So jurisdictions currently use their dollars to pay for services that are not deemed medically necessary, and what changes on January 1st is there becomes this new funding source of Medi-Cal or Covered California funds that are available, but those availabilities are restricted to medically necessary services. That does not prohibit a jurisdiction from using their own resources to cover a non-medically necessary service if they deem it appropriate.
Steve, if I might just add a follow-up with a hypothetical there. I've recently been talking to some providers and as well as counties who, are used to a model that they feel is very effective in reducing recidivism with respect to drug treatment that funds a longer period of treatment than I think they expect will be reimbursable under Medi-Cal. So let's say for the month or months that are that don't fit into the length of treatment that's covered by the new enhanced drug Medi-Cal, is that something that counties will be free to contract for and pay for separately?
Again, as long as it's not a medically necessary service. Where the nerd in me is being cautious in the answer, Jenny, is under the Medi-Cal rules, a payer cannot pay for a service that otherwise Medi-Cal would cover. So if you have a jurisdiction that, for example, wants to use X residential treatment center and the managed care plan that services that jurisdiction uses Y residential treatment center, and that managed care plan has determined that 24 days of residential treatment in Y is medically necessary and appropriate, the county could not pay for X for those 24 days because that would be violating the Medi-Cal rule that I would be having someone other than Medi-Cal be the payer for medically necessary service. On the 25th day, there would be nothing that would prohibit the county from transferring that individual from Y to X and or for paying for Y. But the crucial rule set to understand here, which is what I'm expressing, is for a non-medically necessary service, counties are free to spend their resources as they see fit. For medically necessary service, where Medi-Cal is the payer, then the county cannot pay for a service that otherwise Medi-Cal would pay for. Did that answer your question, Jenny?
Yes, thanks.
All right, I think I have another question if I can read it. Kern County has a large portion of very low-income inmates. Many have never paid taxes. The application process uses the IRS database. Therefore, many inmates will need to provide the documentation as they do now. Is my understanding correct?
The short answer would be no. So, and I want to reframe that slightly differently. I think that it is a safe bet to say that an overwhelming majority of folks who end up in our county jails have not paid taxes. And whatever income they have received, they have been receiving off the books and underground. The way that the program works is that individual would simply have to state that they had not received an income that will reconcile with the IRS records, and that will be sufficient to determine eligibility. The challenge is where the individual reports an income that's at variance with the Data Hub's records, and then I believe California is going with the 10% rule. Then as long as it's not greater than 10% difference, that individual will still be auto-enrolled. If the difference is greater than 10%, then it requires a secondary level of review. But for all intents and purposes, for most jail inmates in California, their reported income is 0, and that's all they have to put down on the form. I.e., you do not have to have an income tax record in order to be eligible.
What are the opportunities and grant funding to conduct outreach and enrollment for criminal justice populations?
Jenny, do you want to do your navigators and assisters explanation here?
Yeah, sure, absolutely. And I can actually fill this out with a little bit of additional information at this point. One really important source of funding for outreach and enrollment assistance is Covered California. They have 2 programs. One is the Navigator program, which is focused more on outreach than the Assister program is. The Assister program, which is also currently, I think, being referred to as the in-person assistance program, is really focused on working, one-on-one with individuals and families who are submitting an application and assisting them in that process. For either of these programs, the grants are flowing through Covered California. They're structured differently. The Navigator program is more of a traditional grant, and the Assister program has a structure where entities are paid per successful application. The way to get involved doing in-person assistance is to apply. The application process is actually open right now on the Covered California website. You can go as an entity and apply to be a certified enrollment entity. There'll be a training for both individuals, which are called certified enrollment counselors, and the entities. Coming up, there'll be a number of trainings scheduled to actually get certified. And getting certified is the way that then you access those $58 payments per application. Now, another important development that's been coming for a little while is that the Covered California money pays for successful applications for exchange plans. However, that's being supplemented by a partnership that the state formed with the California Endowment. The California Endowment provided some money to Covered California to also now offer $58 per successful application for a Medi-Cal application. So I think actually that makes the in-person assistance program a much more attractive option for enrollment of justice populations, because there will be so many eligible for Medi-Cal in those groups. Now that you can get money for enrollment in Medi-Cal or an exchange plan, I really feel it's something that people that work with this population should look into. And the eligible organizations for that in-person assistance program are county health, and more social agencies, not public safety agencies, unfortunately, and then a whole range of community-based, faith-based organizations, as well as healthcare providers. So, reentry type of organizations or those that do jail inreach, this is a really good opportunity for them.
So we have another question. Do you have suggestions for how to educate judges about how to use that this benefit could be helpful in getting better services to offenders so that they might consider more split sentencing and other kinds of alternatives?
Well, I think there are a couple of things going on there, Sharon. I think, as you know, we've had some internal conversations with Cal Forward and Californians for Safety and Justice about beginning some statewide judicial trainings that would be on a statewide basis. On a local basis, what I would suggest folks do is they start with their district attorney. And to the extent that their prosecutor has been part of the convenings and is supportive of the overall goal, that they encourage an informal conversation between their county administrator and their prosecutor to understand some of the fiscal impacts that can be developed using Affordable Care Act dollars. I think that most of the courts in California have been financially in a very challenging place. And I think to the extent that judiciary begins to understand that Affordable Care Act dollars might have the potential to enable counties to free up dollars that could then be used to help the courts, which have been between a rock and a hard place, I think that at a local level you will find probably more openness from the court to thinking about how they could facilitate effective use of the ACA. So I frankly think on a county level, it's a set of discussions that happen preferably between the CAO and the prosecutor. On a statewide level, we're still exploring how we can start doing some overall judiciary training.
Great. So another question is about, you had sent out an IT kind of paper about how counties can use IT to expand their abilities around this. Can you talk a little bit about that paper?
Sure. So Ben Butler, COCHS Chief Information Officer, just wrote a paper which was distributed in August to folks who have attended the convenings, talking about the different ways in which information technology connectivity can be built between jails and communities. And if anyone is on the phone who does not have a paper and would like it, if they go to our website, cochs.org, they can download that paper from our homepage. That part of what COCHS has understood is that there are many moving parts that will be necessary in order to really implement the Affordable Care Act. And part of those moving parts are the processes of collaboration that we've been talking about at these convenings and in these webinars. Another aspect of that moving part is information technology and moving information effectively between the jail and the community and moving effectively between non-jail components of the public safety system. So the purpose of this paper was to provide some examples and an intellectual frame for how folks can consider moving data back and forth.
And so a follow-up to that is about while the counties are doing these sorts of things that you're suggesting, what are some of the things they can do now that will help them to facilitate information sharing?
So what we would recommend is that just as what's coming out of the convening so far, Sharon, has been the development of collaborative processes to rethink systems, that there also begin to have collaborative processes to rethink information systems. And for example, in Fresno, at the Fresno convening, we were discussing a simple sneaker net where the jail would download the demographic information that they had on a daily basis on a CD, physically deliver that CD over to the welfare department, and the welfare department would then use that information to begin the enrollment process. I think there's a lot of here and now things that folks can consider as we wait for this big new information age to dawn. I think when you've seen one county strategy, you're going to see one county strategy. But I do think there's a lot of here and now activities that folks can consider.
Okay, another question is, where should we refer people who aren't eligible for Medi-Cal or enrolled in other health coverage?
Other than the Covered California website. So if they're undocumented and they are not eligible for Medi-Cal or Covered California, then the county, through their $19,000 obligation, will need to maintain responsibility for those individuals. Presumably that's happening through the in most jurisdictions.
Okay, if anybody has any other questions, if you could submit those to us, then we can ask those questions. Otherwise, is there anything else, Jenny or Steve, that you want to offer, something that's been prompted through the questions people have asked?
No, I think this is growing great.
I did want to mention, Sharon, thanks for asking. The question that I just answered about grant funding, I wanted to mention this isn't a grant per se, but it's just to kind of fill out the information that you have about where the money that the California Endowment has pledged for Medi-Cal enrollment is going. In addition to funding the $58 payment for successful Medi-Cal applications through Covered California, there's also some money that's going directly to counties that's specifically targeted for reaching Medi-Cal eligible people that are in hard-to-reach populations. And homeless and reentry populations are one of those targeted populations. So that money is going to be flowing from DHCS to the counties through a formula. And I just wanted to point it out because it's going to be another possible, source of funding for reaching justice populations.
Great, thank you, Jenny. Any other questions from folks? Okay. Well, what I want to direct you to is a slide that's up now, which is what Jenny had talked about. I apologize, Jenny. I should have put that in there earlier. Was the help desk for Californians for Safety and Justice, and their website is up on the screen, so copy that down. We'll make sure we get that into our next email out to folks so that you have that, because then you are able to ask those questions directly to Jenny and her team. And we will include the answers to those in the FAQs that we're developing. We hope that those will be helpful to folks so that as one person asks a question, we know that other people are likely to have the same kind of question, so it will give people, some of those things up front that they can take a look at. And I think if we don't have any other questions, then the next slide is just my contact information, which I think probably most people have by now. So feel free to contact us. We'll get you to Jenny if you miss the help desk number or have any difficulty accessing that. We all work closely together so we can get you to the right people regardless of who you call or how you get to us. So I think with that, we are done. And I think we just wanted to remind you that we're going to be sending you a survey about this call today that will ask you, kind of evaluating what went well, what things that you would like to see differently. And remember also that I sent you, and I'll send this again. Oh, we do have another question, which I'll ask as I finish this. Please remember to answer the survey that we sent about how to make these most useful in general in terms of the time of day, that sort of thing. And we'll make sure that we send that again to you. So I do have a question from Jeff Ham, who asks, Section 17,000 of the Welfare and Institutions Code, not Section 19,000.
Sorry, yeah, you're right, Jeff.
And then the second part of the question is, counties are not responsible under Section 17,000 to pay for medical care to undocumented individuals. So not a question, but more of a clarification.
I didn't know that. Thanks. I didn't understand that. I appreciate that clarification.
Good. And then we can also put that, include that in our Q&As. Any other questions or clarifications from folks? Okay. Well, thank you, everyone. Remember, we'll be sending you a registration link for the next webinar, which will be the third Thursday of October. And we look forward to having you all back then. And we will have some additional counties that will be involved as we're doing a convening for Sacramento County with Yolo, El Dorado, and potentially others, and Santa Cruz with potentially their surrounding counties, and Monterey definitely. So thank you so much for joining us. Please make sure you complete the surveys, and we will talk to you next month. Thank you.
Bye.